Today, we are diving into a hot topic that's making waves in the medical world. You've probably heard of Ozempic, Wegovy, or semaglutide. This medication that's been a game changer for people with diabetes and for weight loss and cardiovascular protection, decreasing heart attacks and strokes in diabetics and non-diabetics as well. But here is the groundbreaking question. Could Ozempic not only lower your risk of heart failure, but also revolutionize how we treat this challenging condition? Stick around, because we are breaking it all down in simple terms. But first things first, what exactly is heart failure? It's when your heart has trouble pumping blood to the rest of your body to deliver oxygen and nutrients, leading to symptoms like fatigue, shortness of breath, and swelling your legs and exercise intolerance. And this condition is more common as you age, especially for those with conditions like diabetes and high blood pressure or obesity. And there are two types of heart failure. Heart failure with reduced ejection fraction. This is when the heart's ability to pump blood out is weaker than it should be. Just think of it as a pump not having enough power to push water through a hose. And there is another type of heart failure with preserved ejection fraction. It's also called diastolic heart failure. Here, the heart pumps out blood normally, but it's stiff and doesn't fill up with enough blood in between beats. It's more like a sponge that it's too rigid to soak up much water. And both types have similar symptoms. And it's about 50% of people with heart failure has one type, the other 50% have the diastolic dysfunction. How many Americans have heart failure? Approximately 6.7 million Americans have heart failure. And alarmingly, the number is expected to increase to 8.7 million just in 5 years. And heart failure increases with age, and your lifetime risk of developing heart failure is 24%, approximately 1 in 4 people. And half or more of people have heart failure have this heart failure with preserved ejection fraction, or called diastolic dysfunction. And the sad part is also the opportunity is about a third of the US population without any symptoms is at risk of developing heart failure in the future. How bad is heart failure? Heart failure is associated with a very high mortality. If you are 65 or older and you end up being admitted to the hospital with heart failure, your chances of dying in the first 30 days after your discharge is about 5 to 6%. And your chances of dying in the first year is up to 35%. Heart failure is worse than many cancers. So, where does Ozempic fit in? Ozempic is a medication originally developed for type 2 diabetes. It belongs to a group of drugs called GLP-1 agonists. And without getting too technical, this medication helps control your blood sugar and help people lose weight and have been shown to decrease heart attacks and strokes in diabetics and non-diabetics as well. In obese people, Ozempic has been shown to decrease the risk of heart attacks and strokes, achieving benefits that go beyond what the previous therapies have been able to deliver. It is thought that they reduce inflammation and improve the function of your blood vessels as well. Here is the exciting part. Early research indicates that Ozempic might lower the risk of developing heart failure in people with diabetes or obesity. But let's take a closer look at heart failure with preserved ejection fraction, the type of heart failure that's been particularly tough to treat. In fact, we haven't had any treatments at all. A recent study just published in the New England Journal of Medicine in 2023 explored the effects of the GLP-1 receptor agonists like Ozempic on patients with this type of heart failure. And the results showed that patients experienced improved symptoms such as less shortness of breath, better exercise tolerance. In fact, on the 6-minute walk test, people increased the ability to walk by about 70 feet, which is quite remarkable. And they improved their quality of life based on the Kansas City Clinical Questionnaire scoring system, increased by 8 points compared to the previous treatment available, that only increased the score by 0.5 to 2.3%. And we're talking about the best treatments we had. They were spironolactone, Entresto, and SGLT2 inhibitors like Farxiga and Jardiance that you probably heard about. This finding suggests that Ozempic could potentially provide significant relief for these patients with this type of congestive heart failure. And we know high blood pressure diabetes are two major causes of heart failure. Don't wait until you develop a heart failure. Prevent it. Treat the root cause of it. And to learn more about how to lower your blood pressure naturally, watch this video, High Blood Pressure, Top 10 Foods to Avoid. I'll put the link above and on the description below. Until now, we had no treatment for this type of heart failure. And all we could do was window dressing. We could give you a water pill to improve your shortness of breath. Ozempic is a paradigm shift. We now are looking at obesity not as a coexisting disease, but as a root cause of it that we can treat. And to learn more about Ozempic and your heart, watch this video. Can Ozempic lower your risk of a heart attack? I'll put the link above and on the description below. And remember, your health, you must preach, as I said, take control. See you next video.